Patients often ask, well, how do I know if I'm at risk? What do I look for? There's a lot of medical criteria and rigorous definitions of how many family members at what age you're required to qualify for testing. The bottom line is use the common sense rule. If you're at a Thanksgiving table and you happen to mention, gee, we have a lot of cancers and Aunt so-and-so got a cancer. And if there's, use a sniff test. If there just seems to be a lot of cancers in the family, that's already the first step. You don't have to figure out what you're at risk for, what genes. Let the healthcare provider do that. But we're at a point now where the family history is actually becoming less and less important, which I am reluctant to say because it is an important part of genetic counseling. But for instance, all ovarian cancers are now tested for the gene mutation. And if you just focus on family history, you're going to miss 40% of the mutations, or if you're adopted. So I would say family history is important, but if you've had a personal history of cancer, especially ovarian cancer or breast cancer at young ages, or any other cancers at young ages, those, or the number of cancers, they all factor in. So I think the first question is to ask, don't just say, oh, it's the power lines or something, I'm going to get it next. Start asking questions. Is there something genetic in the family? And let the healthcare provider or the genetic counselor figure that out.
Did you know that not every breast cancer patient needs chemotherapy? In fact, today, there's a way to identify whether or not you'd benefit from that chemotherapy based on the biology of your tumor. To learn more about the Oncotype DX assay and how to discuss the results with your physician, just press this button.